ਜਿਹੜੇ ਹੋ ਤੁਸੀਂ ਪ੍ਰੋਗਰਾਮ ਖਬਰਸਾਰ ਦੇ ਨਾਲ ਸਵੇਰੇ 8 ਵਜੇ ਤੋਂ ਲੈ ਕੇ 10 ਵਜੇ ਤੱਕ ਅਸੀਂ ਪ੍ਰੋਗਰਾਮ ਪੇਸ਼ ਕਰਦੇ ਹਾਂ ਔਰ 9:03 ਇਸ ਸਮੇਂ ਹੋ ਚੁੱਕੇ ਨੇ। ਜਿਸ ਤਰ੍ਹਾਂ ਮੈਂ ਸ਼ੁਰੂ 'ਚ ਐਲਾਨ ਕੀਤਾ ਸੀਗਾ ਕਿ ਅੱਜ ਸਾਡੇ ਪ੍ਰੋਗਰਾਮ ਦੇ ਵਿੱਚ ਮਹਿਮਾਨ ਹੋਣਗੇ ਸਾਡੇ ਆਪੋਜੀਸ਼ਨ ਪਾਰਟੀ ਦੇ NDP ਦੇ ਲੀਡਰ ਐਂਡਰੀਆ ਹੌਰਵਿਥ। ਸੋ ਐਂਡਰੀਆ ਹੌਰਵਿਥ ਇਸ ਸਮੇਂ ਮੇਰੇ ਨਾਲ ਜੁੜ ਚੁੱਕੇ ਨੇ। ਸੋ ਗੱਲਬਾਤ ਸਾਡੀ ਇੰਗਲਿਸ਼ ਦੇ ਵਿੱਚ ਹੋਵੇਗੀ। I would like to welcome Honorable Andrea Horwath. She is a opposition leader from the NDP party. We're going to discuss some issues, ongoing issues related to the COVID-19 and what the government's efforts are doing and what NDP is pushing the government to do more. Andrea, welcome to the show and good morning to you.
Good morning to you and thank you so much. I'm very, very pleased to be with you this morning.
So how do you assess this current situation of Ontario in this COVID-19 situation?
Well, I think it's fair to say that we're in a serious crisis here in Ontario and that there's lots that needs to be done to help people and businesses to get through these next number of weeks and possibly months. And what we're trying to do as the opposition in Ontario is try to be as constructive as possible, try to encourage the government to do a number of different things to help lighten the burden on people. Everything from cutting insurance rates down by 50% to making massive investments in our long-term care system, which was falling apart before this crisis started, and of course is in an absolute disgraceful situation now with so many of our seniors becoming ill and losing their lives to the virus.
Let's first discuss your latest email, your press release about the 50% break on auto insurance payments. You have asked the Ford government that you must act on it and reduce the insurance to 50%. Please shed some more light on this issue. That is it in the hands of the Ontario government or it's in the hands of auto insurance companies? Who can do that? Can government push the companies to reduce it to 50% in these months?
Oh, absolutely. I mean, the government, has a significant amount of power that they can wield right now, and they're doing it in many different areas. But this is an area where people just obviously, first of all, let's face it, the NDP has been fighting to get our insurance rates down for years and years and years, right? Kathleen Wynne and the Liberals said that they would do it, and then they got reelected and they said it was a stretch goal, that they weren't going to be able to do it. Mr. Ford has promised that he was going to get the rates down, but of course that's not happening at all. And so, we're going to go back to that fight after this is all over. But in the meantime, people aren't driving. I mean, look out on the streets. Nobody's on the streets, and yet their insurance is continuing to have to be paid. And so we're just saying that give drivers a break for this interim time for the next 3 months on auto insurance, and then particularly drivers who have lost income, like people in the taxi industry, for example, in the limo industry, they should be able to completely defer their payments until after the pandemic is over. It's important to make sure that we understand how hard hit, particularly the taxi industry is, and they have been sounding alarm bells in the last number of weeks and the last number of months with massive increases in their insurance already. So now's the time to give them a break, right? Because they have no customers either.
Some drivers, they did cancel their insurance at this time because the insurance is so high, they can't afford to pay it with so little business out there, or they had to park their car. And definitely people who are still running their taxis, or they definitely need a break on it. there's a break on everything, but how you can push the insurance companies, that's the biggest question that you're raising. And next thing, you have talked about the seniors. If we look in Ontario, there's about over 51 senior homes they got affected with this coronavirus big time. There's a big investigation going about the faulty masks were delivered. What you think, like, why they spread into the senior homes so quick, and if there was anything to control that, or is there any negligence of anyone that why it went to the viral into the senior homes?
Well, I mean, I think that's something that we are going to have to look at when this is all over to determine exactly, what went wrong. But I can tell you this: we don't have to wait until then to make things better in those homes. Those homes have been understaffed for a very long time. The wages of those workers is very, very low, and we can't keep those PSWs. They're called personal support workers. We can't keep them on the job because the wages are minimum wage, and yet these people are taking care of our seniors, our loved elders, right? The people that built our province. And so it's been a disgrace for a long time. What we're saying to the government is, let's fix this now. Let's increase the wages. Have a very aggressive hiring initiative so that we can get more people to take up those positions. We know that there's lots of people that are trained to be PSWs, personal support workers, but they've abandoned the field because it's hard work and it's low pay and it's often part-time. So that's another issue. I've asked the government to stop allowing people to work in more than one nursing home. Because what happens is they have a part-time job at one nursing home, and then they go and work at the other nursing home to get enough hours to put food on their table. What I'm saying is that shouldn't be happening right now. Let's just keep everybody working in one home and prevent them from going into other places, because then you just have the more risk of a possible spread of the infection. The other thing is, we need to make sure that the personal protective equipment is available to nursing homes. We need to make sure there's much more testing of residents and staff in nursing homes, and so these are things that we've asked the government to do. It's not good what's happening. It's actually tragic and shameful what's happening in the long-term care sector, and we need to fix it. We can't wait till after the virus to deal with some of these concerns, because people deserve better than that. Family members deserve better than that. In fact, the government's asking people to consider taking their family members out of long-term care, but they're not guaranteeing that they're going to have a bed, when this is all over. So that has to stop. I mean, if you're taking somebody out, you have to be guaranteed that they can get back in afterwards. And we're asking the government to set up a fund to help financially for families to be able to buy the supplies and things that they need to take care of their loved ones at home. So there's a number of things that we can do, and the government needs to take action right now. People deserve so much better than what's happening, and those folks are terrified. Those people in long-term care and their family members and the staff that work there, they're all terrified of this virus, and rightfully so.
Recently, Mayor Patrick Brown wrote a letter to the health minister and to the Premier of Ontario to hire internationally trained doctors and nurses to bring them into action so that they can help in this pandemic. Same kind of question was raised by you. Do you think is it possible to train them so quick and bring them into the force on the front line?
Well, I think what's really apparent in Ontario is that there are lots of people that are already trained. I mean, I could just speak for the concierge, one of the concierge the concierge people that work in the building where I have a unit in Toronto, because I'm always in Toronto, so I need an apartment there. He's a doctor. He's a doctor from his home country, but he's working in a condo building because he can't get the credentials very easily. He's taken the test 3 times, and that's just him. We have all kinds of people who are here, who have come to Ontario, who have so much to offer, like so much skill and capacity and education and training and experience that they bring from home when they move from all over the world to Ontario, and then they come here and they can't practice in their field. So yes, I support this, obviously, but I've been working on this for 30 years. We shouldn't be in the situation we are, where people are not able to to build their life with their skills and talents here in Ontario. It's not good for them, and it's not good for the province. We're losing out on both sides. So what I would want to see is not only the government try to engage more people in the healthcare sector particularly, but I don't want it to stop there. When this is all over, people should be able to work in their field, right? We should be able to open those pathways to ensure that people have a much easier chance, a much easier pathway, and a better chance at working in their own field. So when this is all over, let's not just go back, to the status quo. Let's redouble our efforts, and let's even make an effort to solve this issue, which has been ongoing for decades now, and it's just not acceptable.
Time is running out, but I would like to have here another 3 to 4 minutes. Only 2 questions I will ask, then the next question, I would like to talk about Brampton. Brampton, you are the first one who came to Brampton and bring the awareness about hallway healthcare in the Brampton Civic Hospital. Then you had a meeting with the Brampton mayor to raise this issue. Then again, Brampton declared a health emergency long ago before the coronavirus came. Now the numbers of coronavirus in Brampton, if we compare the Peel region, they are going up. Brampton is past the stage first. And do you think, what do you say at this point about the situation in the Brampton and the rest of the Ontario about the ICU beds, and are our hospitals are ready to handle that kind of patients and in the critical ICU?
Well, I mean, there's no doubt that that the hospital system has been underfunded and neglected by the Liberals and also by the Conservatives. I mean, the underfunding has been it has been criminal, and in Brampton, it's just been such a frustrating and an inhumane situation, right? I mean, there's just no way that we should have the kind of population growth that we see in Brampton, and yet no ability or no willingness of governments to keep up to that pace with healthcare investments, including new hospitals. And so that's a big problem, as you know. And you're right, we've been fighting that fight for a long time. But because both the Liberals for many years froze hospital budgets, and now the Conservatives do the same, and of course we don't have what we need in terms of readiness. Of course we were caught kind of on our back foot, if you will, when it comes to our healthcare system. And we started asking questions about this in the legislature before the virus took hold, and we were accused of being too partisan. But at the end of the day, you can't have a hospital system that's prepared for this kind of an outbreak when you've been underfunding it for so many years. And so, it's not where it should be. It's just not where it should be, and it's many years of underfunding and neglect.
May I know if you know that when first time this coronavirus question was raised in the Ontario Parliament, and who raised it? Can I ask you that?
So we raised it. We raised it first, and if I'm not mistaken, it was early. It was early in March or late in February. We were talking about it, and it was because we knew it was coming. And again, that's our job, is to put the government on notice when we think that they need to be paying attention to something. But since the virus has taken hold, we've not been, as I said earlier, we're not trying to be partisan. We're trying to be constructive and productive, and give the government ideas of what they can do to help people.
No, I appreciate
The
it.
time will come for us to do the analysis, right? The time will come.
All parties are working together. That is appreciable. Andrea, my last question is going to be about the small businesses. Are you satisfied what Ontario government have done to protect the small businesses, or there's a need to be done more? What is your say on this one?
Oh, no, I think that there's a lot more that can be done to support the small businesses in our province. We actually put, a bunch of suggestions forward to the government that includes things like helping with the rent, so asking the government to help small businesses with paying 75% of their rent for the next 3 months. Up to $10,000 a month. We've asked the government to provide for small businesses a moratorium or a forgiveness on all their utilities. We've asked to stop any lockouts or evictions of tenants, of businesses that in their locations to prevent them from being kicked out. We have a number of pieces that I think are necessary to help small businesses, because small business is the backbone of Ontario's economy, and I've heard from a lot of small businesses that they just don't fit into the federal government packages. They don't fit into those packages. They can't borrow more money. They don't have the capacity to borrow more money, and so they don't see those federal solutions as being helpful, and that's why we've asked the provincial government to step up to the plate and help our small businesses get through this. Because at the end, what we want to do is make sure that we still have some small businesses that are able to continue to operate and to employ people and to help rebuild our economy.
All right, Andrea, thank you so much for your time, and keep up the good work.
Thank you so much.
Thank you.
You take care. Okay,
Bye-bye.
bye-bye. Oh, Happy Vaisakhi is coming very soon.
Happy Vaisakhi is coming. It's the Easter weekend as well. So thank you so much. And we are just, we're figuring out how we're going to celebrate Vaisakhi. We have a big parade, and this year it's all shut down. Everything is shut down. We're just trying to figure out how we're going to celebrate this big event.
Yes, well, we'll celebrate doubly next year.
All right. Thank you so much.
Okay. All right. Bye-bye.
Bye.